Hello again and welcome to this COVID-19 update for you and your community here on the Bass Coast, presented by Bass Coast Health. A couple of people to meet today, one you've already met, Nikki Baker, Infection Prevention and Control at Bass Coast Health. Welcome back, Nikki.
Hi Kevin, thanks for having me back.
Yeah, nice to have you. So last we saw each other, Nikki, we spoke about cleaning of hands, and I learnt very, very quickly and efficiently how to clean hands. Is it still important to have clean hands and washing our hand routine?
Very important. And this is something that we continue after COVID-19 as well, because we know through good hand hygiene we can prevent the spread of a lot of different microorganisms.
So if there's one thing you can still keep doing, and that's washing your hands correctly and using the sanitizer.
Do we do another run through?
Absolutely. Oh yes, look at that. Oh yes.
So remember, we start with the front to the backs.
To the backs.
Making sure we do the webbing down to our thumbs.
Thumbs.
Correct. And then always making sure we don't forget the nail beds.
Right.
And then a bit of an all over.
Did it with paint last time, and I saw how much space I left.
Good job.
Done. Well, we've all been heartened by the news that the way this pandemic has been handled here in Australia may mean we have escaped the horrors that have confronted many other parts of the world. It doesn't mean we're out of danger yet. It is still a pandemic and it is still dangerous. At Bass Coast Health, every precaution is taken to protect both patients and health staff whenever anyone is seen to have been exposed to COVID-19. PPE, personal protection equipment, is still vital. Remind us why, Nikki.
Okay, so PPE is the barrier that is put between the nurse or the healthcare professional and their patient.
Yeah.
So the idea is we want to stop transmitting infections. So we protect ourselves. So in the event that somebody comes into the hospital with COVID-19, we'd be looking at a droplet contact spread, which means we'd put a gown on to protect our clothing, because if somebody was to sneeze or cough all over our clothing and then we go into the next room and start treating another patient, there's a chance that we can then transmit the virus to the next patient. Things like gloves to protect our hands. We wear face masks. So I've actually brought in just an example of the face masks we're wearing at the hospital at the moment. And the reason I thought I'd bring this in is now that we're noticing people in the community are starting to wear face masks, I think it's really important to understand how they should be worn and how they're disposed of safely.
Yeah, good.
So you always treat a face mask, the front of the mask, as dirty. This is how we teach our staff, because if you're always thinking of it as dirty, that's going to stop you handling it when it is dirty. Hence, will stop you spreading microorganisms. So the idea is you use the either the ties or in this case the bands. You'd pop them, I won't do it because I can't speak. You'd pop them over your ears. Once you've got the mask over your ears, it's really important that you pull it down so it sits under your chin. And then with the top band, you need to fit that across the bridge of your nose, so you get a firm fitting with your mask.
Because that's quite firm, the top of that, isn't it?
Correct.
Yep.
So that's fine. Then you go about your business, and whether it's in the community and you're shopping or you're going down to the CUGP, whatever, then once you get home, it's really important that you first clean your hands, as we've shown, and that might be just washing with soap and water when you're at home, before you go to your face. If you're thinking that the front of your mask is dirty and potentially contaminated, the last thing you want to do is go to a dirty mask and have dirty hands and be up around your mucous membranes, because that's where we know that viruses and bacteria can be transmitted. So really important, you wash your hands first. You always only handle the mask by the straps, or if you've got the ties, you untie the bottom tie first and then you go to your top tie, because it gives you more control over your mask. So once you've taken it off, you're handling by the straps, it's straight into the rubbish bin.
Right, yeah.
There's none of this crunching up into your hand, because of course then...
The outside is dirty.
Correct,
yeah.
Exactly. So yeah, just a good reminder I think for everybody.
All right, and you've got some lovely masks that have been kindly, generously made.
Yeah, beautiful masks. So we've got Jackie and Stephen Wakefield, which are community members, who have very generously and kindly made these material masks. So in a hospital, we're mandated to follow standards with our equipment that we use, which means the equipment has to be tested and meet standards of Victoria. So that's for our face masks we use clinically within the hospital. However, with the fabric ones, obviously they haven't been through that process, but we found a really big need. We've got our new mothers who are birthing and going into influenza time, COVID COVID-19. So we're going to be giving our new mums a couple of these masks to take home with them. So when, if you've got a cold or a runny nose and you're trying to breastfeed your brand new baby, the idea is the mum can wear the masks.
That's perfect.
Pop
They're
them in the
beautifully
machine.
made too,
Yeah,
aren't they?
they're lovely. Pop them in the machine. They're very hygienic. Then you've got a bit of control. It doesn't mean that you can invite Nana and Pa over and make them pop a mask on and still cuddle the baby. We're still keeping that physical distancing
There's
happening.
still a little while to go there.
But for the new mums, brilliant.
There,
So we're
good.
very grateful.
Thank you, Nikki.
You're welcome.
And we have some heavy-duty masks, which my next guest is going to tell us about. G'day, Matt.
G'day, how you doing?
Tell me where you are from and what you do with your company, Free 3D Hands.
So we're from Phillip Island and I'm the founder of a charity called Free 3D Hands.
Yep.
And we make hands and assistive devices for people with congenital limb differences.
Right. That's your normal business.
That's our normal business.
But you have transferred your business into something quite special that I know Bass Coast Health are over the moon about. Tell us what you've done, Matt.
So about 3 weeks ago, we saw that there was a massive shortage of PPE here in Australia, and we have 20-something 3D printers that we normally use to 3D print these hands, and we thought, well, we can use some of the excess capacity to start making face shields for people on the front line who are continuing to serve us in the community.
So did you just come up with this idea by yourself, or was it in conjunction with Bass Coast Health?
Well, there was a group over in the Czech Republic that released an open source face shield design, and we thought, well, that's something that potentially we could adopt here in Australia.
Yeah.
So the first thing that we did, obviously, we needed to work with the health industry, and we actually got in touch with the Therapeutics Goods Administration initially to understand whether it was something that we could actually do, and we got a lot of support from them. We've actually registered our face shield on the Therapeutics Goods Register, and we got in touch with Bass Coast Health through Nikki,
Yeah.
and she took a sample away to evaluate. To get some feedback from the team, and we've made some.
And it came back with a 10 out of 10.
No, it didn't actually.
Did it? Oh,
No,
okay.
it's, without their input, it wouldn't be anything like it is.
This is it. Let's
Yeah.
talk about it. Let's look
So
at
this
it.
is the face shield, and the open source design had really poor face coverage, and Nikki and the team requested an extra 45 millimetres of face coverage, so it comes from ear to ear to prevent aerosol entering from the side.
These are the ones we're seeing on TV all the time. I mean, we're seeing right around the world face shields like this being worn. So how many have you produced?
We've made about 1,200 to date.
Wow.
And as of today, we'll have delivered just over 1,000 units.
To Bass Coast Health?
To Bass Coast, we'll have delivered 500.
Right.
And we've delivered them also to a lot of organisations right across Australia, free of charge. Being a charity, we've had some incredible support from the community to be able to cover the manufacturing costs to pay for the materials. Initially, it was a $14,000 investment in purchasing all of the materials. The most expensive piece being the laser cut PETG visor, which costs about $6 alone.
Right. So how long does it take to make one of these?
On a 3D printer, it takes about 2.5 hours actually, which is quite a long time.
And how many printers do you have?
We have 18 printers running around the clock. And as of today, through Health Purchasing Victoria, we've had a commitment of some government funding to help us to provide labour around the clock to be able to continue manufacturing these for as long as required.
Gee, that's great, isn't
So
it?
it's been an amazing community effort to get this over the line.
Fantastic. So how many hours a day are you working? Do they take, do you need to be with the machines while they're doing this, or they just run by themselves?
They can run by themselves, but they need to be continually running. So I've worked every day for the last 4 weeks, except for Easter Sunday.
Oh, good on
But
you.
now
Well
that we've got support, we've got people coming and working till 10 o'clock at night to keep the machines running.
That is supreme and superb. Amazing work. Congratulations on it. I know that everybody at Bass Coast Health are exceptionally pleased and grateful for the work that you're doing. And of course, these shields are an absolute necessity in terms of protecting both patients and staff in particular, because they're the ones working with, first hand with patients. You've done a great job.
Well, in our mind, the true heroes in the community are all of the staff at Bass Coast Health that are continuing
Very much true.
continuing to keep us all safe. And this is just a really small way that Free 3D Hands as a charity can say thank you to them by providing these.
Excellent. Matt Botel from Free 3D Hands, got it. And thank you for coming in today.
Thank you, it's a pleasure, and keep up the amazing work.
All right, thank you. And of course, it was Nikki Baker with us as well. Keep sharing us on Facebook, and thanks for watching today. Until I see you again, take care.